side of the heart deals with oxygenated blood, which is loaded with oxygen, whereas the right side deals with deoxygenated blood, which has been robbed of oxygen. The left and right atrium is where blood arrives at the heart. Veins, which always carry blood towards the heart, feed into these arrival chambers. The pulmonary veins bring oxygenated blood from the lungs into the left atrium, whereas the superior and inferior vena cava bring deoxygenated blood back to the right atrium. Conversely, the left and right ventricle can be thought of as the exiting chambers where blood vacates the heart via arteries. The left ventricle is attached to the aorta, which is the biggest artery in the body and carries oxygenated blood to the body's organs and tissues, whereas the right ventricle is attached to the pulmonary artery, which carries deoxygenated blood back to the lungs. The heart also has heart valves which stop blood moving backwards in the heart. When they are open, blood can flow forwards. The four valves in order of how they are encountered are the tricuspid valve, the pulmonary valve, the mitral valve and the aortic valve. The tricuspid valve sits between the right atrium and the right ventricle, the pulmonary valve between the right ventricle and the pulmonary artery, the mitral valve between the left atrium and the left ventricle, and the aortic valve between the left ventricle and the aorta. The tricuspid and mitral valves can be referred to as the atrioventricular valves, as they are situated between the atrium and the ventricles, whereas the pulmonary and aortic valves are semiluminar valves, which are situated between the ventricles and the outflow vessels. An easy way to try to remember the order of the heart valves is to use the mnemonic, "Try pulling my aorta." So, how does blood travel through the heart? Deoxygenated blood arrives at the right atrium via the superior vena cava and the inferior vena cava. As the right atrium fills, the tricuspid valve opens and blood flows through it into the right ventricle. As the right ventricle contracts, the tricuspid valve closes and the pulmonary valve opens, allowing blood to flow into the pulmonary artery in order to be sent to the lungs for gaseous exchange. Once oxygenated in the lungs, blood flows to the left atrium via the pulmonary veins. As the left atrium fills, the mitral valve opens and blood flows into the left ventricle, and as the left ventricle contracts, the mitral valve closes and the aortic valve opens, allowing blood to flow into the aorta to send oxygenated blood to the organs and tissues of the body.